share experiences, and on some occasions to build solutions to problems that have been encountered. And members of these groups not only learn from each other, but their collective expertise can be leveraged to drive the development and uptake of insurance products. So I would encourage any of you, if you're not already involved in any of the best practice groups of the network, to join one of them and help develop the sector further. We currently have 5 best practice groups, and you can go see them on the Microinsurance Network's website. Now, for today's webinar, I don't need to tell you how important it is for how important MSMEs are in driving economic growth and creating jobs globally, particularly in developing economies. However, despite their critical role, they are often vulnerable to risks, a variety of risks, and traditional insurance often fails to to meet their needs, meet their unique needs. And this webinar will explore how advancements in data collection, analytics, and AI are reshaping MSME insurance. And insurance are able to design new products and customize these products by leveraging this real-time data. And we'll hear about some of these examples over the course of this webinar. And just to mention one last thing that I think is important. I mean, this webinar was built on a recently launched toolkit that was launched by the BPG, which is entitled "Implementing a Data-Driven Approach to MSME Insurance," and you can download it on the network's websites if you want to know more. So I'm going to stop there. I want to let everyone else jump in, and it'll be much more interesting listening to you guys. And I'm going to hand it over to Jeremy Gray, who's going to say a few words, a few introductory words as well. Jeremy.
Thanks, Matt. Yeah, I think it's. I'll keep it very brief. It's very exciting, I think, to have this discussion. We know how important data is in shaping tailored, valuable products for consumers, and we know how important the MSME segment is. So, as I think some of you have been part of the journey, we've been on this journey with the BPG, on the MSME BPG as part of the MIN for 6 or 7 years now, and have produced, I think, had a lot of interesting discussions and some interesting papers, I think, that we've published as well. So I think this is another one, and I'm looking forward to the discussion. So I can hand over to Vera, I think, or Karimi.
I think Vera.
Thanks, Jeremy. Karimi, is it? Yeah. Yeah, no, I think we're really excited also for the panelists to just dive into different insights and lessons learned from using data to actually better understand MSME resilience and to also better understand how to serve MSMEs with value-driven products. So the panelists we have here today are Marco Del Rio, who's a senior consultant at BFA Global, and who has done really extensive data work on MSME resilience through the Strive Resilience Learnings Network, understanding, especially in Mexico, core dynamics related to financial health and resilience of those really small enterprises. Then we also have Tania García, who's the leader of the Microbusiness survey at Colombia's National Administrative Department of Statistics, who will shed more light on the different methodologies and how they collected data for their microbusiness survey. And hand in hand with that, I think also goes our third panelist, Mabyr Valderrama Villabona, who is leading the ESG agenda for the Colombian Insurance Federation and has worked with that microbusiness survey data, but also with other data to think through what it takes to establish more inclusive insurance products and to better serve MSMEs with those. And then our last panelist will be Liebe Berger from CENFRI, who's done a project looking at health insurance specifically, and there are some really interesting insights on the use cases of data in better designing health insurance products and in really understanding the customers and the value that can be gained from that. So yeah, just want to see if Karimi, if you want to add anything to that.
Not really. I think you've captured it well. Maybe just to add a few of the housekeeping rules in case anyone would like any kind of support, please message the main executive account in case you need any kind of support. And this session will last for 1.5 hours. And the session is being recorded just so that the recording can be shared with the larger audience. So that's just it. Vera, feel free to move on to the next session.
Okay, everybody, Marco just shared some of those insights you have gained on MSME resilience in Mexico from all the work you've been doing.
Thank you so much, Vera. Good morning.
Sorry,
good
Vera.
afternoon.
Sorry, Vera, to jump in. No, is that it was a confusion with the agenda. So we will start with FASECOLDA in this case. So I would like to give the opportunity here to.
Gracias. Gracias a todos por este gran espacio. Por supuesto, Matthew, el equipo del Microinsurance Network, Nicolas, Sara, por invitarnos a compartir nuestra experiencia en este espacio. Efectivamente, un pequeño cambio en la agenda, Marco, luego te vamos a escuchar. Qué pena haberte interrumpido de esa manera. Bueno, yo voy a compartir con ustedes una experiencia sobre la cual hemos venido trabajando en FASECOLDA durante el último año. En este momento voy a compartir en mi pantalla. Por favor, avísenme si la están viendo.
Perfecto.
Perfecto. Bueno, queremos compartir con ustedes una experiencia importante que hemos venido desarrollando.
We have been developing from the insurance industry in Colombia, in particular through activities that promote innovation and development of insurance products focused on this specific population. We want to tell you about this innovation project that is called Financienda Segura, Safe Financial Store. The point is producing financing products for stores in Colombia. We're talking about small stores here where they're selling different types of goods and services. And these goods and services are crucial for the basic food basket. And I want to tell you about our experience. Now, before that, I want to give you a broad landscape, an overview of why we developed these topics. FASECOLDA, and which is the federation that represents the microinsurance industry in our country, has built a significant alliance with the government, national government, and also at international level. We have developed an alliance also with a leader network that allows us with financial education, and also with the NDP in Colombia. So we are developing some innovation products so that we are trying to promote the development of new products for sectors that are usually underserved. Now, within this, we have developed 3 big challenges, and I want to here focus on the last one. We have called it Financienda Segura, safe financial store or finance store. And this is a product that would be supplemented with a savings mechanism and also with an embedded insurance product based on the needs of this population in our country. To develop this innovation challenge, which is Financienda Segura, we have leveraged our alliance with FASECOLDA Alliance and also for the United Nations Program for the Development. And we used the data provided by the Omicron survey. It is Omicron provided by our government. I know further on my colleague will be telling you better about this survey. This survey has the aim of surveying the practice, the different practices and the conditions of micro businesses in our country. So we use this information to be able to profile this small store population so that we could inform the decision making within this program. The numbers that we took into consideration for this were four. First, the relevance of these neighborhood stores. They are a significant pillar in our country. They add up to around 50% of the food basket sales in the country. This is very important because this highlights the role that stores play as essential providers for the Colombian consumers. Another thing that we could see is the access to different credit products. Only 25% of store owners in Colombia ask for a loan in Colombia. And out of those who requested credit, 38% try to not fall into debt. So there is a sort of reluctance from store owners to access credit products. And some of them don't see it as needed, any financial product. This shows us that there are big barriers that we need to overcome. And this is hindering the growth possibility of small store owners. In the third place, it showed us a low penetration of insurance products for these MSMEs. We found that only 11.6% of the premiums issued in 2023 were SMEs products. This shows us that most of micro businesses in our country are underserved and they're undercovered. They're not covered in the face of risks, which results in them being more vulnerable in an uncertain landscape. This also showed us that there is a big need on the part of store owners. We also had some interviews with a group of store owners, and we created an archetype reflecting the actual needs of this population in Colombia. This allowed us to see innovative solutions that could be more tailored to the needs of these store owners, meaning adapted to the reality of small store owners and also the realities that they're facing. Now, I want to tell you the following. When developing this innovative project, our main aim was being able to launch solutions that were, first of all, comprehensive, but also useful, and solutions also that would cater to the needs of these small store owners, including financing and also insurance against risks that put their continuity in peril. And we're talking about our country, of course. These are the principles that were on which our development was based. Not only did we try to support the sustainability and development of their businesses, but we also wanted to foster financial inclusion of these small store owners. We also wanted that within those solutions packages, we would have an embedded insurance. That is why within the framework of this innovation initiative, we took into consideration certain aspects. The first one is the fact that financing was specifically focused on payments, so that store owners could add essential goods and services for their equity, for the working equity. In the second place, we wanted that the amounts were accessible and adaptable. We also were looking for short-term loans so that we could cater for the needs of these store owners. In this way, we could make them swift, we could make them agile, so that they could easily access resources without having to go through very complex and lengthy processes. In the third place, we wanted to embed an insurance product within this financial solution. This should be hand in hand with an insurance product that would protect the store owner. Then in the fourth place, we wanted innovative methods or approaches to help these store owners to be able also to profile these store owners. This would allow us to identify the characteristics and risks faced by store owners. In the fifth place, we also wanted to be able to close or bridge the gap, the gender gap. We were trying to include aspects of gender equity. And then after that, in order to be able to be part of this challenge, we wanted this solution to be flexible. That was a principle. We wanted it to be based on the characteristics and specific needs of store owners. We also wanted it to be open to multiple payments. We wanted to facilitate simultaneous payment. Perhaps a store could receive procure their goods from different providers, and we wanted to provide that flexibility to them. Then we also considered the fact that solutions would have different channels. We wanted to consider channels that would be user-friendly, intuitive, and that they would make the payment and the repayment processes very easy and streamlined. We also wanted to include saving or transactional products that would supplement the needs of the store owner. Financial literacy was another significant aspect that was taken into consideration in this project. We wanted to generate capacities with practical solutions so that store owners would improve their knowledge on financial management, store management, and also some solutions like insurance. And then we also provided technical support or technical advisory. What we were looking for here is that the solutions provided by the teams would also provide technical support in a continuous way through the financing and insuring process. This would be a support provided to the store owner through their entire journey with us. The point here would be that the store owner would make the best use of the product or the service that they would have embedded in their product. Now, to summarize, we had 42 organizations who participated, including underwriters, insurer companies, fintechs, insurtechs, banks, academia, cooperatives, etc. These 42 organizations were divided into 20 teams, and I want to show you who were the winners of this innovation project. First place was taken by the team of Colombianos Seguros, Entre Amigos, and the Mabyr with their solution Sencillo, easy. This solution is in the process of being fine-tuned to be able to develop innovative services offering rotational products of up to $1,130. This also includes a financial education tool through a program called Viva Seguro that is led by FASECOLDA for sustainable development and financial literacy. Second place was taken by the group of Bolívar Seguros, Fenalco, and David Plata. VC Agil. VC is a colloquial way to refer to your neighbors, from vecino, neighbor. So this focuses on improving financial flexibility of stores in Colombia through a rotational a loan, including a climate insurance product. This is a digital loan for working equity. They had resources for $15,000 and then $25,000. These resources are being used for adjustments and technical improvements, with the idea that these prototypes actually become products that will be launched in the market. And of course, products that will provide solutions to the store owners in the country. This was developed thanks to this profiling that we were able to do thanks to the information gathered by DANE. It is important to be able to have this information and update it so that we can make good decisions to develop financial and insurance products for our store owners through channels that are usually not traditionally used in our market. Thank you very much.
Thanks so much. That was really interesting to hear, and I think it gives us very much that holistic view of the enterprise. So really seeing what are the different needs and what role can risk transfer play, but what role also can other financial services and potentially also non-financial services play in strengthening MSME resilience. So also really interesting to hear more on the financing side and combining it with insurance products. And I think the other point that really just stood out is how comprehensive survey data can support the product development and can really enable us to better understand how a product needs to look like, but also how it best should be distributed to a certain target segment. So now I want to hand over to Tania to tell us a bit more about the Microbusiness survey, which really built the foundation of this innovation challenge that was just presented. Over to you, Tania.
Good morning. Good morning. Thank you very much for the invitation. My presentation will be in Spanish. Entonces, el nombre del Departamento Administrativo Nacional de Estadística, pues les
on behalf
agradecemos el
of this
espacio
National Statistics
día de hoy,
Department, we thank you
hablar
for
de
this
este tema tan
space
apasionante
today.
del mundo
And
del
thank you for allowing
microbusiness,
us
¿no?
to
De
speak
las
about
pequeñas
this
unidades económicas.
such
En
interesting topic, which is the world
se
of
cuenta con la
microbusinesses.
cifra de
In
5.8
Colombia, we have
millones de
5.8
micronegocios
million
que aportan alrededor
microbusinesses.
del 20-25%
Around
del Producto Interno Bruto
20-25%
del
of
país.
our GDP
Discúlpame que hago un
responds
paréntesis, Nicolás, si me
is by
puedes
them.
ayudar con la presentación. Muchas
Nicolas,
gracias.
could you please put the presentation up? Thank you.
Y generan alrededor de 7 millones de
They
empleos.
generate
Es
about
decir,
7
estos
million
micronegocios entendemos como unidades de máximo de 9
jobs.
personas, que ese es como el parámetro de inclusión que tenemos para
This is the inclusion
estudiar
parameter that we
estas
use to study these
realmente
business units.
es la unidad económica más común.
This is the
porque
most
la que
common
genera más empleo en el
business
país.
unit in the
Y
country
efectivamente estas
and the one
unidades
generating the
son
most jobs
muy
in the country.
vulnerables a la crisis,
And
como nos lo
obviously,
han
they're
dicho
very
los
vulnerable to
demás
crisis, as my
panelistas. De
other
hecho, entre el
fellow
2020 y el
panelists have already
2021
mentioned.
en el país se
As a
perdieron
matter of fact, between
alrededor de
2020 and
500.000
2021,
micronegocios
we lost
por
about
el
500,000
COVID-16,
micro
por la
businesses due to
pandemia,
the
¿no? Y recuerdo
COVID-19
mucho que en esa
pandemic.
época el gobierno nacional nos
And I remember
decía,
that at that
bueno, por
time,
favor,
the national
entrégueme las
governments were
cifras de
saying,
dónde están
please
los
tell me
micronegocios,
where
cuáles son las
those micro
características,
businesses are, which are
cómo
their
son los
features,
dueños, las dueñas,
what are
cuáles
the
son sus
store
costos, sus
owners like,
ingresos,
which are
cómo
their
podemos
costs, their
focalizar
income, how can we
una
focus
política, ¿no? de
a
ayuda
policy
a estas unidades
so that we
económicas.
can have these
Entonces,
economic
realmente el objetivo
units.
de esta
So the
charla
objective
es
of this
presentarles
talk
y contarles un
is
poco cómo
actually
funciona esta encuesta de
introducing
micronegocios
you
y
to
cómo
this
tiene un gran
micro
potencial de
business survey,
análisis de
how it works,
información.
and the
Entonces voy a
great
comenzar
potential
la
for
parte
information
conceptual,
analysis that
el
it
diseño
has.
conceptual de la
So I'm going
encuesta.
to start with the of this
Nacionales
survey.
para el estudio de estas pequeñas unidades económicas
So the first
es
thing that we
implementar
did to study these
las
economic
encuestas
units
mixtas en
was
dos fases.
implementing
¿Listo?
mixed surveys
Mixtas
in
porque
two phases.
usamos dos
They're
encuestas.
mixed
Una
because we
encuesta
use two.
base, una encuesta
One is
social,
a
que
base,
normalmente es la
a
encuesta laboral
social
de los países. En
survey
el
that
caso de
is usually
Colombia
the
es la
work,
gran
the
encuesta
regular
integrada de
work
hogares, que está
survey that
en el
is used in the countries.
esta es, digamos, la
And
encuesta
this
más
is the
robusta que
most
tiene DANE, tiene
robust
una muestra
survey that we
muy,
have
muy
at
grande
DANE.
que
It
permite,
has
pues,
a
precisamente
big,
analizar
big
muchos
structure that
fenómenos dentro
allows
de la
us to
economía
analyze
colombiana.
different
Entonces,
phenomenons
en
with
esta
the
encuesta
phenomena
de
within the
base, que es la gran
Colombian
encuesta integrada de hogares,
environment.
identificamos
And then
a
through
las
this, we were
personas
able to
que
identify
tienen
those
negocios,
people
que
who
tienen
businesses,
pequeños negocios. ¿Listo?
small
Entonces,
businesses.
en una segunda fase,
So second
volvemos al mismo hogar
a phase,
y
we came
aplicamos
back
la encuesta de
to the same
micronegocios,
home
que
and
ya
we
es una
used the
encuesta
micro
económica.
business
¿Listo?
survey,
Entonces,
which
esta
is
encuesta
more an economic.
económica en función
This
de la unidad
dives deep
económica, ¿no? De esa
into
actividad
the
económica.
information of this economic
Entonces,
activity.
aquí lo interesante de explicarles
What's
esta
interesting to
parte
mention
es
here
que se tienen
is
estas dos
that
grandes encuestas
they
que se
have these
pueden
two
cruzar
surveys
porque tienen un directorio
that can
común, o sea,
be
tienen una llave única que
cross-referenced
cruza la
because it
información
has a
de
unique
la gran
key
encuesta
that
integrada de hogares
cross-references
con la
information
encuesta de micronegocios.
with
Y
the
la encuesta
general home survey
laboral de
with
la gran encuesta
the
integrada de hogares nos trae
small
información
business
de
survey,
hogar,
micro
nos
business
trae
survey.
información de la persona,
The
nos
general
trae
home information provides
sociodemográfica,
us with information about
nos
the
trae información
demographics,
sobre
the
la
person,
seguridad social,
the
la
household, their
educación,
social security, their
información de
education,
migración, por ejemplo, es un
their
fenómeno muy
immigration
interesante de estudio.
status.
Es un capítulo
We
que
also
pues
have
habla
a
sobre este tema y
chapter
sobre fecundidad.
regarding
Entonces,
this
digamos
topic.
que la gran encuesta integrada de hogares te da alrededor de 350 variables que
So the
después tú puedes
general
cruzar con,
home
como
survey
les decía, la
gives you
encuesta
about 30
de
variables,
micronegocios.
and these can
Entonces,
then be
claro, en
cross-referenced
adelante
with
nos
the
vamos a
micro
enfocar en la encuesta
business
de
survey.
micronegocios. Les voy a contar
Then we
qué
will
capítulos
focus on
contiene, qué
the
información
micro
para poder
business
encontrar
information.
allí.
Which
Entonces,
parts does it
en un primer
have? What
momento,
kind
pues
of
hacemos
information you
una
can find in
recolección
them?
sobre
First of
la
all,
información
in the
de
first
la unidad
early
económica,
stage,
el nombre
we gather
comercial,
information
dónde
about the
está
economic
ubicado,
unit,
cuál
the
es la
name, the
actividad
business name,
económica que
where it is
realiza.
located,
Fíjese qué
what
interesante
economic
escuchar a
activity
mi
they're
colega de FASECOLDA
developing. It's interesting to hear what my colleague from FASECOLDA was saying. They used this survey for the specific project. But of course, this survey covers all aspects: services, transportation, construction, everything. We also include information on the company, the entrepreneurship spirit, what drove them to opening this business. And then we have something very, very important, because micro business can be developed anywhere. They can be in the home. Almost 25% of micro businesses are located in a house. But then there are also micro businesses that have offices or premises, etc. But there are also some micro businesses that are mobile, that they use. Some of them use transportation. Some of them will have a motorbike taxi or a bike taxi, etc. So this is very important because we need to know where they are located. Of course, we asked about the characteristics of employees, if they're paying social insurance, if they're covered by the different programs, if they receive the different labor benefits. We also ask about education and technology. And then we have questions related to the economic activity, like costs, expenditures, income, assets, etc. We also have information about financial inclusion and working equity. So what I wanted to say is that this has a great analysis potential, because it not only focuses on the business, but also on the person and their home. That is part of the presentation. Now, next. Now we're going to dive deep into these results. Which are the characteristics of these micro businesses? The results I'm presenting are for the year 2023. This is the last publication that we have. It has already a series, because we have data from 2019 all the way to 2023. And it is very important because it allows us to study this throughout time. Something important is that they are directed in a freelance way. They are freelancers. They may be they have a partnership with someone, but they are not employed by anyone. Then the other percent is that micro businesses. 64.3% of micro business owners are men, and 35.7% are women. Now, if we focus on the economic activity, this can vary significantly. For instance, in the restaurant business, there are more women than men. But in construction, then we have more men than women. So this percentage varies from sector to sector. And most of these micro businesses are subsistence micro businesses. What does it mean? It means that it started because they did not find other labor opportunities in the market. So they went for their own micro business, which are very precarious micro businesses. Then when we made an analysis of the multidimensional poverty of the store owners, here we can see that 41.4% of store owners belong to poor households, and 32.8% belong to vulnerable households. Now, regarding the distribution of micro businesses, those who can pay social insurance and those who cannot, we found out that 65% of them cannot make contributions. What does this mean? It doesn't mean that they're not covered, but they're covered by the subsidized regime. But what we want to find out with this information is if the business provides enough profit to be able to make contributions to social insurance. But 87.4% can make no contributions. This shows us the level of informality of these units. Something else, talking about the formality of these micro businesses, is accounting, whether they have accounting books or not. In the year 2023, 65.5% of micro businesses had no accounting, no bookkeeping. This is a very high percentage. Then there are people who have other kinds of accounts which can be very informal. For instance, a notebook where they write their daily income and expenditures, and that is only 29.5%, a very low percentage. Now, regarding the distribution of micro businesses, if we are considering the type of registry before the tax authorities, only 23.8% are enrolled. That is to say, the rest are not known to the tax authorities. This allows us to see how informal they are. We were also wondering where they are located, which is what I mentioned at the beginning, where they are located. 28% are located within the household. Some of them will be hairdressers or small stores or service that they may have, for instance, in their house garage. So they turn their house garage into their business. And it can be perhaps within their own home. There can be hairdressers that will be done within the living room of the house. These are very representative numbers. Those are 28% of the businesses. Then we have the door-to-door or home delivery. That is to say, people who sell their products going to the different places. That's 19%. We also have farms. Of course, we do research the agricultural business, which is 13%. 12.5% does have a separate shop or store or office, perhaps workshops, etc. And we can see also the other locations. Another thing that we took into consideration was for how long has this business been in place? And the answers are surprising. 46.2% say that they have been developing the same economic activity for over 10 years. And some of them will have 5 or more years. 17%. So what we can see is that even though they're volatile kind of activities, they are persistent throughout time. If we look at restaurants are the ones that come up and disappear the fastest. And then we can make this analysis, especially divided by economic sector. And this is the last result I wanted to share with you, which is related to mobile sellers. We asked about who they ask for money if you need money. And we have the results for 2023, and it's surprising that over 50%, almost 58% will get money from lenders, which we call abusive lenders. We call them gota gota, and it means that they pay interest on a daily basis. This is a very, very complicated panorama, a very complicated landscape for these businesses. So this is what I wanted to share with you. There's a lot more information, so I would like to invite you to visit the DANE webpage. If you need any technical assistance or support, we will be very happy to help you. We're here for you for any questions that you may have about this presentation, and thank you very much.
Thanks so much, Tania. That was a great overview, and I think one of the main data sources to really start any analysis with is publicly available data, like these large government agency-driven surveys. And just looking at that data already can provide so much richness and insights. And then from there, I think one can see, if additional qualitative data, focus group discussions, etc., are necessary to understand further some of the trends you can identify through their data analysis. And I think the other big point from what I've been hearing is how much these large data sets also enable you to better understand different segments and different types of businesses and how they differ. So I think even something like we have those businesses that might be more located within their own homes that don't really separate much their own risks from the business risks. So here we obviously need to look at quite different resilience and insurance products than for those that might be operating outside of their homes. So they have business premises risk and that have risks that are more distinct from the business owner, down to how these larger and more representative data sets really enable you to segment MSMEs and to really look into different types and what their specific needs are and how they can be reached. So thanks a lot for that overview. Over to you, Marco, now. Very keen to hear a bit more around what you have been seeing when looking specifically at MSME resilience in depth and the dynamics associated with that. Over to you, Marco.
Thanks, Vera. Can you share my deck, please? Yes. Yeah, okay, wonderful. Thank you so much. Well, my name is Marco del Rio, and I'm a senior consultant in financial services and livelihoods at BFA Global. Thank you so much. It's my pleasure to be here, and thank you to CENFRI and the MEAN team for inviting me. And as mentioned before, I will discuss about resilience. But first of all, I really want you to ask why resilience is essential, and why is it essential to incorporate a lens on measuring and understanding MSE resilience from the standpoint of any organization. And for me personally, working with vulnerable populations, I've learned that resilience manifests differently depending on the target segment. For instance, women-owned MSMEs face more significant challenges in coping with shocks, and these businesses often need more time due to social norms, lower human capital levels, reduced access to finance, and consequently, they were disproportionately affected by COVID-19 pandemic compared to male-owned businesses. However, resilience analysis extends beyond gender, and it reveals a complex mosaic of factors with different characteristics based on a business profile and at the industry in which it operates. And we will walk through some of this in these presentations. So moving on to the table of content. First, I want to talk about 3 different topics. The first one is just to give you a brief introduction to BFA Global. Then we will move to MSE resilience, what we have found in our research. This will be the bulk of the presentation. And finally, we will provide some insights on how to best support MSE resilience. Moving on to the next slide, just very quickly, BFA Global is an impact innovation firm that combines research, advisory, venture building, and investment expertise to build a more inclusive, equitable, resilient future for underserved people and the planet. And our team is comprised by the economists, entrepreneurs, researchers, product managers, designers, data scientists, and policy and regulatory specialists with a deep local expertise. We were founded in 2006, and BFA Global is headquartered in Nairobi and Boston with strong presences in the Americas, Africa, Asia, and Europe. And our expertise focuses on several areas, including financial health, inclusive tech, digital finance, and fintech, gender finance, and women empowerment, among other things. Next slide, please. Okay, so moving on to resilience, right? And first of all, I want to mention, can you go back? Just I want to mention that the learnings that I'm presenting here have been informed by the Stripe Mexico program, and this program aims to support thousands of micro and small enterprises in their journey to become more resilient since 2022. This program has been supported by the Mastercard Center for Inclusive Growth. But before that, the program design was informed by what we call the white paper Road to Resilience, developed by BFA Global in 2022. And in this research, we found, starting from this, a need to define what we mean by MSME resilience. What are the drivers? What are the pathways to resilience in any given country? And this research connects with the program implementation as it allow us services, because we don't only provide acceleration services in this program, but we also conduct research and ecosystem building. So based on this agenda, we first developed a framework to better understand MSME resilience. And this is important because everybody wants to understand more about resilience. And because we were just getting out of the COVID-19 pandemic. And so resilience was top of mind for everybody. But in particular, like understanding resilience at MSME level was complicated, and not necessarily having a framework for understanding that. So we say, well, this is something important to dig deeper. And then we started this research about resilience. And resilience is really a complex construct that really defies easy categorization. I mean, it's not a mere outcome, but it's rather a capacity to actively influence those outcomes. And this capacity is not easily quantifiable, as it is multidimensional and it's not directly observable, right? So we start to build a framework, the framework that you're seeing on the screen, which is, we use the term capabilities as a combination of assets, behaviors, and strategies. So it's not just one of them, it's the three of them, right? And we group these capabilities into 4 pillars: financial, digital and operational, entrepreneurial, and psychosocial. In the case of the first capability, the financial capabilities, we include frequent savings and access to credit in case of emergency. We all know that it's really relevant for advancing growth, resilience, and so on. We also assess operational and digital capabilities. And we did this by understanding business vulnerability to supply chain disruptions. So we asked how difficult it will be for them to restore the supply of materials and inventory if they lose their leading or their main supplier. And we also include the digital adoption because, well, research has repeatedly found that adopting digital tools positively impacts business performances. So we ask about those, from adapting and using digital mechanisms from social media to marketing on social media to digital payments, to accepting digital payments. And we also wanted to know how certain business practices that we believe are conducive to higher performance are being conducted by MSMEs. So we ask if MSMEs keep track of, in a ledger or a notebook, of things like the amount of sales, the debt, the bill payments. So So we call this the entrepreneurial capabilities. In this capability, we also assess whether respondents follow certain rules in case of uncertainty. And finally, we include the psychosocial capabilities that the research has found that things like grid, agency, and business network are closely related to many different like development outcomes, from health outcomes to financial health outcomes to MSME resilience outcomes. So we include those. Next slide, please. But we also wanted to understand a few more things, right? So we wanted to understand what are the predominant shocks that are faced by MSEs. We want to know how long does it generally take for MSEs to recover from a significant profit reduction event. We wanted to understand what are the most common coping mechanisms employed by MSE when confronted by shocks. We wanted to know how effective savings and credit were to promote a faster recovery compared to other mechanisms. We want also to get a sense of to what extent coping mechanisms correlate with business coping mechanisms, because we all know that they tend to be intertwined, right? And also we want to have some sense of the effects of adopting digital tools is having on the level of resilience. So for doing that, we conducted 6,000 surveys with 3 partners, 2 financial service providers. One of them is a microfinance institution. The other one is a financial cooperative. And the other one is a digital service provider that offers services to shopkeepers. And of course, we try to establish a sample that allows us to conduct aggregated analysis to understand gender inequalities. And we also survey various types of MSEs, right? Retail, business, beauty shops, artisans, restaurants, food preparation, pharmacies, and so on, because those tend to concentrate the vast majority of MSEs in any given country, in this case, Mexico. That's what we do. Next slide, please. So what we found, so starting with the shocks, it's not that it comes to a lot of sorts. We have data that this is important. We can measure it. So we found that MSEs frequently face emergencies. It's not that these emergencies end when the COVID-19 winding down. Actually, I mean, they continue. They continually face several unexpected expenses, which one inventory losses, liquidity problems, and many other things that we will see in a minute that put their operation at risk. So most of the MSEs, the survey MSEs, faced in the last 12 months an unexpected expenses or emergency. And well, the most common actually are demand declines, sharp decline in demand, health emergencies, either for the owner or the employees, crime, and increased competition. And we also found that for most of them, it takes more than a month to recover. So we were trying to have a metric, a baseline, a threshold for understanding which ones are more resilient or not. We use the metric of 1 month. For those who could recover, who were able to recover in less than a month, we consider those as a resilient MSE. So basically, kind of a brief summary. Shocks are prevalent, and they tend to be acute, and for most of the MSEs really have a hard time to overcome those shocks. Next slide, please. So moving on to the coping mechanisms, We found that MSEs tend to rely on multiple coping mechanisms, not just one. For instance, in one of our partners, MSE used an average of 2.4 coping mechanisms to deal with shocks. And of course, this figure varies depending on the severity of the shock. The main mechanisms are using savings, reducing business expenses, reducing household expenses, and working extra hours and borrowing money. But it's important to note here that only some coping mechanisms, some coping mechanisms are more effective than the others, and the way in which MSEs uses these coping mechanisms is different depending on the harness of the shock, but also on the time, right? Whether it happens. If it's taking longer to recover, MSEs start to rely on different coping mechanisms, and I think it's important for because insurance, it's this thing that really could prevent them the need to use other coping mechanisms that can be more, let's say, painful, and that also put them, jeopardize their business continuity, right? Like selling some assets, or having a sharp reduction on the expenses, because they won't have the ability to replenish the inventory they have. So in this case, that savings come first in the line of defense, and in contrast, borrowing money or reducing household expenses are more common for more significant shocks. We also found, this is one of the questions that we had, that households of MSE coping mechanisms are completely intertwined. They almost move in tandem. And of course, that the hardness of the shock is negatively associated with the time needed to recover from it. That's pretty intuitively, right? So moving to the next slide, please. Oh, yeah. Okay. So related to the four pillars, we found many interesting things. So going to the financial resilience, we found that frequent savings increase the probability to getting through an emergency in a shorter time, less than a month, by 43% with one partner. Statistically significant evidence. Related to digital resilience, with one partner, we found that MSEs that use 4 or more digital tools have a daily profit of $20, higher than those without it. And we also found positive association between resilience and the ability to find suppliers. Across the board, we found higher levels of grit, but a little bit less on agency and business network, access to business network. And we also found that record-keeping activities is not quite spread among MSEs. Not even like knowing or taking some annotations of what was the daily sales. So those things are we believe that are quite important, because that's the foundation of a more evidence-based reaction against emergencies. Now, digging into the socio-demographics and business characteristics that are more conducive to faster recovery, we found that business owner school attainment is positively associated with faster recovery from shocks. Having at least one employee, being larger as an MSE, positively associated with faster shock recovery, and also Asian profit are positively associated with recovery. Of course, and one of the partners, the sample was so large that allows us to make an analysis based on the activity and the economic activity. And what we found, we try to find which MSCs, which sectors are the most resilient and the less. And we found that the resilience is greater in pharmacies and mechanical workshops and in food production. And on the other hand, artisans, that it's a
on better understanding MSME resilience. This takes it a little bit more granular, I want to say even more focused on the value of that data-driven approach for designing better insurance products, and specifically driving home that need for proper customer analysis when designing your product and your marketing strategy. So Vera, you can briefly go to the next slide. So essentially what we'll be touching on today is leveraging insights from a project that we recently completed, as Vera mentioned. And this project was completed in partnership with the Swiss Capacity Building Fund, as well as Britam and CarePay. And it was really focused on Britam's need to address the core issue within the Kenyan market on the lack of health microinsurance solutions, which could then address the need of the informal sector that have very unique needs, and also to ensure that they can enhance access to health insurance. So to do this, Britam partnered with CarePay, which is an aggregation platform, to leverage data from their Nthiga or mobile health wallet platform, to essentially better understand their clients and also improve the product design and delivery. Data played a really key role throughout this process by revealing various payment and savings behaviors, highlighting barriers like distrust and digital illiteracy, as well as highlighting core needs like a need for outpatient cover, for example. And most importantly, it also, of course, facilitated the customer segmentation that was really crucial for that tailored product design, and also to understand the needs of the core target market groups that Britam wanted to target next for their product. So really the outcome of this project was to have better data-driven insights, which would allow Britam to improve their product relevance, address their client needs, and also enhance their renewals and retention process. And we've developed a string of documents and blogs around this, which will also be available on our website. And I can also share some links afterwards if you'd like to read further. Next slide. So as a brief background, to just kind of set the scene about the microinsurance landscape in Kenya, which is where this project was conducted, we found that rising healthcare costs and low health insurance penetration really push many Kenyans into poverty, and particularly those that are in the informal sectors, work for themselves, and also, of course, those that would fall part of the MSME sector or group. What we found here is that 38.6% of Kenyans actually live below the national poverty line in 2023. And catastrophic health expenses are actually driving millions more into poverty since 2018, which is where a recent statistic came from. So what we also see is that health insurance coverage in this informal sector remains quite low, actually under 20%. And the current National Health Insurance Fund retention rate for this group is also really low. And what they found is that the main reason for this is actually due to a perceived lack of value of insurance. So this really highlighted that urgent need for tailored health microinsurance solutions to address these challenges, enhance accessibility, and also reduce the out-of-pocket expenditure. And where this also ties in with MSMEs, as Vera mentioned, is that out-of-pocket health expenditure is really the main driver for the reduction of resilience for poor and more vulnerable households, and also MSMEs. And FSD Kenya have also reported that health risks are considered one of the major threats for MSMEs, simply because of the fact that it affects business continuity so directly form of the business owner. Can go to the next slide. So this then led us to explore the use cases for data in transforming the insurance industry. And I'm again going to draw from the Britam case study here. But what we found is that there were essentially 4 key use cases, of which the 4th really underpins the others in terms of customer understanding. Where data really comes in quite crucially to better understanding not only your customer, but also ensuring the sustainability of your business, the growth of your business, and also enhancing customer satisfaction. So the first use case is on product innovation. And of course, here is where it becomes really important to analyze the data to uncover those unmet needs. For example, where there are low saving rates or limited payment capacity, which is something that came out quite a lot from analyzing the data that was provided by CarePay. Then there's also based on understanding the unmet needs, being able to then prompt the innovative product design for solutions that can really directly address each of those needs. Another core use case is retention, and this is something that we discussed at length with Britam. And what we found is that the moment that you mention using more data to many insurers, they often freeze up thinking that they have to have very sophisticated systems. But oftentimes, even the simplest methods actually have the greatest impact. For example, many insurers today still don't track retention rates. So every time a customer renews a policy, they see them as a new customer. And of course, this has a whole range of repercussions for better understanding your customer base, because it impacts how you can market to your customers, how you can design products to meet their needs, how you can better target products and marketing efforts towards them. So you can understand that not having that data is actually something that's really limiting insurers from better from, first of all, better understanding their customer base and also improving their product design. And so what we found here is that leveraging customer feedback and behavioral insights through some of the data that came out of this study actually assisted Britam to address specific pain points. So, for example, they used that data on what customers said that they were struggling with to implement biometric systems so that customers no longer had to present a physical card when wanting to access health services. There's also improvements in the claim process that came about because of this, really ensuring that it's more seamless and that it happens faster as well. And they also added more healthcare facilities. And all of this was really in response to what the customers said that they were struggling with, but eventually will also ensure that customers are more loyal, that they are more likely to renew their policy, and also that you retain them for a longer period because you have communicated that value of your product to them. And then the final part is on market expansion, and this is really kind of the core crux, I want to say, of this product, of this project. Because Britam wanted to expand into this low-income market, they then collaborated with CarePay. And this is, as I mentioned, an aggregation platform to access their anonymized customer data, and essentially using that data to segment customers and identify the various distinct customer groupings that came out of it, not only to better understand their needs, but also to determine which target customer groups would actually be viable customer groups for them. For example, serving high-risk users would be a completely different scenario to serving those that already have some kind of frequent healthcare saving behavior in place. And then based on that, also designing tailored insurance products. So this is, as I mentioned, really those use cases that came out that really showcase how you can use data to empower yourself as an insurer to create value, not only for yourself, but also for your customers, and really be able to relay that value, which is a core part that we found throughout the project that really came up a lot in the qualitative feedback, is that customers really just do not see the value in paying, even if it's minimal amounts for insurance, when they don't really understand the benefits that it could have for them. So that is one of those are the key use cases that came out of that. And then moving on to the next slide, onto the core learnings that also came out from the data. I want to say that the most important underpinning insight is that data really is a strategic asset. It's no longer just something that informs your understanding of your clients, but it also is something that's so crucial that if not harnessed properly, can actually risk you falling behind in this really rapidly evolving industry where everyone else is starting to realize the importance of data. So what we have here is 6 core buckets of lessons that have come out from the project. The 2 in grey are kind of the key lessons or overarching, and the others are also just really interesting findings that have come out from this. So starting with the lessons, what we found that first of all is the quality of data is far more important than the quantity thereof, and I think this is something that everyone today here is very familiar with. But especially when aggregating with partners, for example, in the case of this project, the initial target customer group was 4 million customers. And once we received access to that data based on various data sharing requirements, etc., that was actually whittled down to only 150,000 customers that could be used for segmentation purposes. And so having that information up front is extremely important to set expectations from both parties, but it's also crucial to ensure that the data that you do have access to, even if it's only a small portion, is really high quality data so that it can properly inform decision making and really assist you in meeting your objectives in that regard. The second point is on collecting behavioral and transactional customer data. That's really important for segmenting customers, and this links to the first point. What we were able to do with the data that was provided by the aggregator is we were really able to group the customers really nicely into 5 distinct groups, which then assisted Britta in better targeting customer groups they would want to or better identifying which customer groups they would want to target, and also ensure that they have a solid understanding of what those customers' behaviors already are so that they can ensure that the product design really meets those needs and fits their behavior quite nicely. Then, in terms of the key insights that have come out, the first point is on Kenyan customers that are prioritizing value over cost. And this is something that we also wrote a blog about. But what we found that was really, really interesting is that there's a common assumption in the microinsurance space that you would often have to keep premiums quite low to ensure that enough people are able to access it and take up the product. But what we found from the data is that these Kenyan customers are actually seeking out products that really provide very clear benefits to them and that align with their needs, and not just opting for the lowest cost option. So in the case of an inpatient and outpatient part of the product, what we assumed would happen is if inpatient is already relatively expensive, then, or let's say if inpatient already has a relative price range, you would assume that an outpatient offering, which in this case was relatively more expensive than an inpatient product offering, you would assume that the outpatient offering is taken up less. But due to the fact that Britain was able to convey the value of that outpatient benefit, they were then able to actually see that as customers were taking up inpatient products, they were also taking up the most expensive form of outpatient products in the same kind of trend as well. So that was a really interesting insight to say that customers aren't really just going for the lowest cost option, but really the highest value option. Then what we also found is that there is a need to focus a lot more on retention and not just customer acquisition. So this links back to a point that I made earlier about not keeping proper retention rates in terms of, or not tracking retention rates. That's really important to prioritize retention as well, because once you have a focus on more customer-centric strategies, you actually also ensure that customers will renew and retain their policies. So it's kind of this, it's not, I wouldn't say it's a double-edged sword, but essentially what you're trying to achieve is also what you achieve through the means to an end. So instead of just focusing on acquiring new customers, focusing all of your efforts on new customer marketing, actually focusing on retaining your customers and ensuring that the product as it stands meets their needs, actually ensures uptake and retention as well over time. Then another point that came out is there's a value in being responsive to market data signals. So Britam has indicated that they now have actuarial teams on standby that are frequently reviewing customer data as it comes in, just because the information that came out from this project on just better understanding the customer's needs on the ground actually indicated to them that it's so important to ensure that you're able to really be agile in a market where customer needs change over time, and that you're also able to improve your product design accordingly. And then finally, and this links to a point that was made earlier as well, is that qualitative data also revealed customer mistrust of insurance. And this is also where the MSME angle comes in, with not really understanding the value that insurance could provide to them. And this is really driven by that financial and digital illiteracy. So what Britam did here was acknowledging this need and then designing their onboarding process in such a way that they still have a digital onboarding option, also a self-onboarding option where you no longer have to engage with any agents or any third parties. But the other angle, and this was what was mentioned earlier, is that people really still value face-to-face connection. And it's so important to understand the context of the market that you're operating in, just because even though we are pushing for digitalized solutions, more contactless solutions, many customers who operate informally may still struggle with trusting the product that you're providing them, and will actually benefit from face-to-face interactions with community members who they already trust. So this is really where their agent-led education model came in quite strongly. And again, this would only really have come out from the data. Otherwise, it may have never been known to the organization. Vera, you can go on to the last slide, please. So bringing it back to recommendations for the insurance industry, what we've gleaned from this project and also from the discussion today is that there really is so much to gain from data, but you need to ensure that you have to be strategic about it and ensure that it really aligns with the objectives that you have. So for the case for Britam, and then also for the case for the insurance industry as a whole, what we found is that there really is a need to change the strategy. And with that, we mean shifting from a reactive to a proactive strategy. So not really just using data to react to current trends, but really using it to shape future opportunities really proactively. And the next step is to think through how you go about collecting and gathering that data. So in this case, adopting a strategic partnership for data access really ensured that Britam had access to a lot more data on a potential customer base that they were trying to reach. And so partnering with organizations like aggregators can really ensure that you have access to meaningful customer data. A third point is also that there is a need to advocate for open finance principles, and really encouraging frameworks that enable secure data sharing, because that is one of the things that consistently trips up these types of projects whenever there are data sharing agreement issues. And that's really where you can unlock the potential of customer insights without then risking their privacy, of course. And then a final part of this, the data collection and gathering section, is also the need to invest in baseline data collection tools. So as I mentioned, many insurers often think that they have to have these very large data sets to be able to innovate. But what we found is that even simple tools like just tracking your retention or conducting customer segmentation when you have enough data available on them can really yield such valuable insights that will serve you well in adjusting your product design. And then finally, it's essentially about determining what you want to do with the data. So a core part here is to simplify the process of gaining access to information about the product, and then also educating customers on the value of that insurance product. That really will feed into the issues that we have with uptake of the product. And then finally, also looking into the design of innovative solutions. So this is where behavioral insights become really important, because they can really inform really innovative solutions like the gamified insurance models that Discovery Health Insurance has been implementing with their Vitality program in South Africa, which essentially uses the customer data to better understand the customer, but then also gives a portion of that value back to the customer to reward them for healthy behavior and encourage their engagement and essentially improve their long-term retention. So that really is just another example of how data can serve both the organization and the customer in a sustainable way that really serves both parties. So thank you so much. I think that's all we have time for today. But I'll hand back to Vera for any further questions.
Thanks, Liebe. And I think it's time for us to wrap up. We're a bit over time already, but also feel free to share your questions with us via email. We will obviously also share the recording with all of you. I think for me, this really now wrapped it up also from the very more like granular private sector perspective, what you can do also with the internal data that you as a private company might already sit on, and what value you can derive from making better use of that data. So I just want to hand over now to Jeremy for some quick closing remarks, and then I think we can conclude the session. Over to you, Jeremy.
Great, thanks, Vera, and thanks to all the panelists. I think it was a really interesting discussion, and yeah, thank you to everyone in the audience who joined and have stayed with us through this long discussion. Yeah, I think it's a really nice progression of the work we've been doing in the MIN Best Practice Group. When we first started, we started with asking the question of kind of what are the key barriers for MSMEs to access insurance? Why is there such a key gap? We moved on to looking at distribution, and now in the last couple of years, we've been looking at data and how providers can better leverage data to provide more meaningful solutions to MSMEs. And I think that the two key elements that are really important that came through strongly from all the speakers is thinking about resilience rather than just insurance. How do we think more broadly about elements of risk management and risk mitigation, and how can data help to inform that and apply that? And then secondly, segmentation, because when we think of MSMEs, it's not just a single group. You really need to think about the heterogeneity within that group and specific solutions for specific groups. So yeah, thanks to everyone for the different insights from quite different contexts and different interventions. It's really interesting to see the differences, but also the similarities between and across the different countries. I think then to anyone listening, just a reminder that the toolkit that we've mentioned is available on the Microinsurance Network website. And anyone who is interested in joining the BPG, please reach out on a permanent basis, please reach out to Karimi or Nicolas, who will definitely add you to the list. And yeah, look forward to more discussions. And we are going to be planning in the new year around the focus for the next year or next couple of years of the BPG. So anyone who has thoughts or ideas, please do feel free to share. But other than that, thank you very much. Have a good morning, day, afternoon, evening, wherever you're based. And yeah, thanks for joining the session.
Thanks all.
Thank you.
Thanks.
Thank you, everyone.
Thank you so much, everyone.